Hi, and welcome back to another episode of 4-Minute Physio. In this episode, we are going to discuss the full screening process as performed when a patient is not referred by the general practitioner. When you find a combination of one or more red flags or any other abnormalities in the screening process, you should always consider contacting the general practitioner or specialist. A full screening process consists of the following steps. 1. Help-seeking question. Ask your patient what his expectations and goals are regarding the therapy. Differences in expectations and goals should be discussed early on to avoid disappointments in a later stadium. 2. General red flags. Red flags are signs that may be predictive for serious underlying pathologies like malignancies, fractures, infections, or problems regarding the central nervous system. Next is a list of all the general red flags that you should be aware of. A general feeling of discomfort or simply not feeling well. Fever. Unexplained weight loss, more than 5 kilograms in 2 weeks. Cancer in history. Long-term use of corticosteroids. Recent trauma. Night pain. Non-mechanical pain. And last but not least, extensive neurological problems. 3. Region-specific red flags. The general red flags apply to every region. However, there are some regions that have their own additional red flags. Well-known examples are loss of bladder control and loss of sensation in the inner thigh region for possible cauda equina syndrome, and diplopia, other known as double vision, and dysphagia, problems with swallowing for possible vertebral-basilar insufficiency. 4. Tract history taking. Some organ systems can cause referred pain based on visceral connections. Therefore, it's of great importance to have a basic understanding of the referred pain patterns of these systems. This sheet contains an overview of the most common categories that we see when taking a patient's tract history. I've also included an example of questions that you can ask for each category. Please pause the video if you want to have a closer look at these tables. 5. Course. For this specific part, it is important to find an answer to the following question. Is the course that this patient is describing normal or abnormal? A normal course is described as a decrease in pain and an increase in function level and participation level within 3 months. If this is not the case, we are talking about an abnormal course. If so, it is important to ask yourself what causes this delay in recovery. The answer may lie in certain psychosocial factors or an imbalance between the actual load versus the load capacity. If the abnormal cause cannot be explained, you have to be wary of possible serious underlying pathologies. 6. Movement related. Try to establish a link between the patient's complaints and movements. Most musculoskeletal complaints are related to specific movements. Many complaints arising from the presence of red flags are often not. Finally, red flags are rarely a standalone sign of serious underlying pathology. Try to form a complete picture of your patient. If you are still in doubt, consult with a colleague, specialist, or the general practitioner. Complete list of more questions for tract systems and region-specific red flags can easily be found on the internet. That's all for today. If you guys have any questions regarding this topic, please feel free to drop a comment below and I will get back to you. If you like this video and want to stay tuned for more, please consider subscribing to my YouTube channel. See you guys in the next episode of 4-Minute Physio.